Thank you, Henry, for the kind welcome and introduction. Henry had assured me there was going to be about 20 people here this afternoon, so I have to say it's just I'm a bit apprehensive about talking to quite so many people. I'd like to begin by saying, checking the slides work, but also saying thank you. Thank you to Alzheimer's Europe, to Heike and to Jean-Georges for bringing this event to Scotland. We're immensely proud that you selected Glasgow in Scotland to be the location for your event, and for the kind words that you offered about the work in Scotland. I'd like to thank Henry Simmons and Alzheimer's Scotland for the work that you and the team have put into making the event happen, working with Alzheimer's Europe. And I'd also like to thank all of you who are here tonight and for the 3 days of the conference. We're privileged to have so many people here in Scotland this week who care so deeply about dementia. I'm hoping that you're here this week, that while you're here this week, that you're going to make a big noise about dementia and tell the world what needs to happen to improve and to make a real difference in people's lives. You're the message carriers and you are the leaders of this agenda. So I'm not going to ask you to turn your mobile phones off. I think that's rather a dated idea. But I am going to encourage you to comment and tweet as we go along. I'd like to comment on what you think matters to you as part of the process, what you agree with and what you don't agree with. And as you do that, I'm going to encourage you to use the hashtag. Can you read that? Okay. Can I get a sense of how many people in the room might be using something a bit like Twitter, as opposed to simply taking pictures of me? Okay. Earlier on today, the reason I've put this up is earlier on today I made a bit of an error. And for a while I was following AEC 14, which is the Agricultural Equipment Conference. And while I was retweeting a couple of the tweets from it, the fact that it finished in March meant that it was a bit dated as well. So I was put right by Jean-Georges, and I think I'm okay now. So it would be good to see if we can actually get this visible on the Twitter space. Over the past few days, I've been reflecting a bit on how we got to where we are in 2014. About 10 months ago, David Cameron used his leadership of the G8 to declare dementia to be the third global challenge after HIV/AIDS and climate change. And I think that was a big deal. That truly put dementia on the world stage in the political sphere. Following from that commitment, on Friday, I attended the third meeting of the World Dementia Council, one of the structures created out of the global commitment, to talk about quality of care and share our experience from Scotland. And it was also good that we also heard from Hilary Doxford, who is a person living with dementia, who came and spoke to the council about her experience. Now, I'm going to encourage you now to follow the World Dementia Council on Twitter, because I think it would be good if they could hear your perspectives about what's important to you, and to hear what you think is valuable and what would improve patient care, person care, and support for carers. So I'm going to encourage you to see if you might want to follow them and give them your messages about what you think should be happening in terms of their agenda. I'm a wee bit sad for them because at the moment they've got about 225 followers, which for a World Dementia Council I think isn't very good. But I'm hoping that they're using that channel to listen to what's being said, and so I'm going to encourage you to use it. Shortly, the European Union is going to launch its second joint action on dementia, with Scotland picking up the baton from France on behalf of the UK. And we're going to be working with probably at least 8 other European countries to do development work on quality of care. The Italian government are using their presidency of the European Union to focus on dementia, and will present more information about the joint European action at that time at their event in Rome, which they're hosting as part of their presidency. And this feels very different from where things were when I took on responsibility for dementia in 2004. Then dementia was just one of many clinical conditions. There was no real policy on dementia. There was no strategic framework. And it received very little political or media attention. In the next 2 or 3 years after 2004, probably only a handful of documents crossed my desk about dementia. And this wasn't because nothing was happening. Recently, a colleague who was previously with Alzheimer Scotland, and I don't know if Jan Clean is here tonight, passed me a set of papers from the early 90s from Scottish Action on Dementia, showing very much that work was going on. And we also could see, when we look back from our ivory tower in government, we can see the work that was being done by clinicians, by the voluntary sector in showing leadership in dementia. But we were late to the party. We weren't there and we weren't present at that time. Things changed for us in Scotland after the 2007 Scottish election. After that election, Shona Robeson, MSP, the then Public Health Minister, arrived with a proposition that dementia should be a national priority. A political focus on dementia has been central to our work in Scotland. Similarly, in 2011, when Nicola Sturgeon came back from the campaign trail, she brought back the message that dementia was one of the top 3 items that was raised with her on the doorsteps. So this was an item that was being put onto the political agenda by people who were living with dementia and who were caring for family members who were living with dementia. The first event that she did after that election was the Alzheimer Scotland event in Glasgow, where she talked about needs for improvements in quality of care. And so at that point, having been already a priority within Scotland, it was further escalated up our priority list. And I suspect that David Cameron may have had similar reasons for putting dementia on the global agenda. Stories from ordinary people living exceptional lives. I must confess that when we started, we did not know exactly how to approach the challenge. But in Scotland, we do start and we work with the principle of starting before we are ready. We didn't know what we needed to do, but we needed to do something, and we knew that doing something would give us the learning and knowledge to do more. So we began in 2008 with a target to increase the diagnosis of dementia in Scotland. And I'm glad to see that the first right asserted in the Glasgow Declaration is a right to timely diagnosis, and I think we'll come on to that later. So there's a good fit with what we're seeing in the declaration that was agreed today. Although a diagnosis of dementia can have a huge impact on individuals and families, timely and sensitive diagnosis, backed by effective and holistic post-diagnostic support, is vital in helping people build their personal resilience and knowledge about dementia, and enabling them to live a good quality of life at home for as long as possible. Diagnosis is also the basis for appropriate access to treatment and support, as well as access to medication that might help. At the systemic level, producing a focus on diagnosis has helped us make the case for the scale and nature of the challenge. Dementia is one of the foremost public health challenges worldwide. As a consequence of improved healthcare and better standards of living, more people are living healthy lives for longer, but that also has the consequence that more people are living to an age at which developing dementia becomes more likely. In Scotland, for us, this means that the number of people with dementia is likely to double between 2011 and 2031, and this presents a number of challenges, most directly for the people who develop dementia and their families and carers, but also for the statutory and voluntary sector services who provide care and support. But until we had begun to raise the visibility through diagnosis, dementia was almost invisible in service planning. So our health boards, and in many cases our councils, were not planning to be able to accommodate and respond effectively to dementia in the services that they deliver. Over time, we expect that a greater proportion of health and social care expenditure will focus on dementia, and there is evidence of that change already. There are no easy solutions, and transformation will take time. Working from the objective to increase diagnosis in 2010, we prepared and published our first dementia strategy, and it was developed in conjunction with people living with dementia and their families, and focused on key changes that we agreed were necessary to produce improvement. A key component of the development of the strategy was that it was approached from the perspective of promoting and protecting the rights of people living with dementia and the people who care for them. Rights are at the heart of what we do. It is our belief in the dignity and humanity of man and woman that motivates us. And, as Henry Rankin said, and you might say we'd almost coordinated this. We fully endorse the principle of nothing about us without us. We take forward all our work in Scotland on dementia with the full involvement of people living with dementia and their families and the people who care for them, and we intend to continue to do so. It's also, coincidentally, where some of the best ideas come from, in that the perspectives that are brought to us from people living with the illness or their families include a richness which we simply would not have access to from our perspective. The first strategy included commitments to develop national standards of care for dementia and a framework for workforce development to build capability and services. We also took forward work on reducing the use of antipsychotics, making psychological therapies more available, and on the quality of care in inpatient environments. And in each case, we approached these work streams from the perspective of human rights. It was a deliberately focused, not comprehensive strategy. It wasn't a policy document. It created a framework for action. But it was constructed on the basis that we would deliver on each of the commitments that we made quickly, and that we would use that work and that delivery to develop the next propositions and the next commitments. So it was intended to be an iterative process. Again, an example of starting before you're ready, understanding that you don't know all that you need to know, but that you need to get on and make progress to enable you to learn more. But also, and Henry alluded to this in his opening comments, building relationships, connections, and a guiding coalition for change, in that our objective in Scotland is to work constructively across all organisational structures and with all people to do the best that we can for the people who live within Scotland. During the period of the first strategy, we delivered on our commitment to raise diagnosis rates in Scotland, and by 2011 had increased the diagnosis rate from about 42% to about 65%. We also used that time to put in place work to develop our approach to post-diagnostic support. So while we were delivering on one commitment, we were developing the knowledge and experience to be able to deliver on a second commitment. Again, I welcome that the second right in the Glasgow Declaration is to access quality post-diagnostic support. Test sites and dementia demonstrators were used to assess the best ways to take forward the commitment locally, to ensure that when we made the national commitment, that we could have confidence both that we would deliver the commitment, but also that it would produce the benefit intended. So the measurement framework we have for post-diagnostic support has a number of quality indicators which look at the quality of the support that's offered, not simply whether we've done enough widgets. It has to be about the experience that families actually have. The process was built on our understanding of the need to build the change process from the ground up, building solutions around people and communities. Our national commitment on post-diagnostic support for everyone diagnosed went live on 1st of April and is a key component of delivery of the second 2013 strategy. There are, of course, many people who have been living with dementia in our communities and who need good quality services as their symptoms advance and as they begin to need more intensive support. We're committed to taking more action to change and improve services for those people as well. The Cabinet Secretary, when he's here tomorrow, will say more about the current work programme, but it now also includes work on care coordination, again using the mechanisms of test sites and demonstrators to develop the knowledge to do that effectively, so that when we roll the commitment out, again, we can be confident that we will achieve the objective that we've set. And this supports and is consistent with the third right of the Glasgow Declaration, the right to person-centred, coordinated, quality care throughout the illness. But not everything in Scotland has been good. We have seen challenges around the quality of care, with the services that are offered not always meeting our expectations in respect of compassion, dignity and rights. The Mental Welfare Commission report into Mrs. V was an example of those challenges. We also see services that no longer meet our expectations of quality and safety. Again, the recent report into continuing care wards in Scotland has shown clear deficiencies of care that we're committed to addressing. Also, people's experience of care is not always good. It was wonderful to hear Jeanette's presentation this evening, but we first came into contact with Jeanette in the context of a story which was clearly very distressing for her, but also distressing for us. And this is how it was reported in the Daily Telegraph. During a relatively short period, 106 different care workers came to offer care and support to her husband Ken, which is a shocking statistic in terms of the need to develop rapport, understanding, and person-centered. And I have to say, it's inspirational that Jeanette is able to work with us, to work with NDCAN on addressing the perspective of carers as part of our work on dementia in Scotland. I'm not proud of this. I'm not proud of the other things which have been reported on. But I am proud of the fact that we can be honest about it, that we don't feel the need to hide it, and that we see it as the basis on which we can build improvement, in that being honest and transparent about your failures as well as your successes is part of the change process. But again, Jeanette, thank you for being inspirational. We're seeing increasing numbers of people being admitted to hospital in circumstances which are unavoidable in Scotland. Part of my new responsibilities in the last year have brought me into contact more with hospitals, delayed discharge, and the experience in accident and emergency. And they're not always getting the care which is appropriate to their needs. We've launched a national action plan to support NHS boards in helping to make those changes and to build on workforce initiatives such as the Alzheimer Scotland Dementia Nurse Consultants and the Dementia Champions. But this is the point at which our specialist work on dementia crosses over with wider policy on health and social care. In Scotland, we're currently working through the most significant change in how we deliver health and social care since 1948. From next April, under health and social care integration, we will have in place new structures to deliver services in ways which are more focused on the needs of individuals, not organisations, where money is used flexibly in support of that objective, and where there is a clear focus on improving performance. It goes hand in hand with the work that we've already taken forward on self-directed support, and will complement the work that we're taking forward to introduce legislation on carers. Improving dementia is at the centre of that broader reorganisation of the health and care system. And I'm going to show you a short film which shows how some services are already being redesigned to fit into that new integrated world. The film focuses on Mr. Muircroft. Mr. Muircroft is the carer for his wife, and they're from Motherwell. They had moved to England in the 1980s because of his work, but when Mrs. Muircroft was diagnosed with dementia, they moved back to Scotland to gain support from family members and from local health and social care services. So the film's about 5 minutes long, and it shows how we think things should be. I should say we didn't prompt Mr. Muircroft to say that they returned to Scotland for better care. He just volunteered that. And to be fair, he did say it was in the context of being able to tap into the wider family network as much as anything. But in the film, what you've seen is how a team, including the community psychiatric nurse, the locality link officer, the home care worker, the social worker and the support worker are able to work together. And there's probably two sides to this. There's an element of this which looks quite mundane. It doesn't look spectacular. There's no fancy technology in there. There's no specialist WISO process or policy that we've done there. This is just effectively managed and coordinated care working for the benefit of an individual. And if we could do that mundane thing generally, everywhere, all the time, that would be a spectacular outcome. And that's our objective. Importantly, the film also shows how services are operating in conjunction with family members who are providing care and support to their loved ones. And I was keen, when we were developing this, to explain health and social care integration, that we were using it to focus on how we were supporting the carer, in this case, to continue to provide the support that they wanted to be able to offer to in this case, to his wife. There's an equal need to support people caring for people with dementia as there is in supporting people living with dementia. We need to understand and respond to the health and support needs of carers better, and to recognise this key role that they play. Again, this supports the third right set out in the Glasgow Declaration to person-centred, coordinated quality care throughout the illness. So what should the future hold? When we framed the second dementia strategy, we set out at the beginning of it 3 challenges. I'm just going to say a wee bit about them, and then I'll conclude. First, we must offer care and support to people with dementia and their families in a way which promotes well-being and quality of life, protects their rights, and respects their humanity. And we described this as a moral imperative. We didn't see this as functional or instrumental. This was something based on the nature of what it is to be human. And we consider that it is unacceptable that it is too often the experience of people that care and support does not meet this standard. Second, we must continue to improve services and support from when somebody presents for diagnosis and throughout the course of the illness, including the support needs for carers. Again, this support must be truly person-centred and should understand care and support from their perspective, not from the perspective of service managers or clinicians. Third, our third challenge was that recognising with increased life expectancy the challenge of providing high-quality care and support to people with dementia and their carers will increase over time, so we face a greater challenge year on year. That means that we must embrace the process of redesign and transformation of services to ensure that we deliver services effectively and efficiently. We simply will not address the needs of people with dementia if we continue to do things the way in which we currently do them. We need better, more agile, more creative solutions to providing care. So how do we make this real and not simply words that appear in a government document? How do we make it tangible? First, we must recognise, and this is important, and this is a key component of Henry's remarks at the beginning, that dementia is not about numbers or costs or projections into the future. It is about person-to-person care. It is about how we treat people with compassion and dignity and work to preserve and maintain people's rights through the course of the illness. Second, we need a workforce with the proper skills and knowledge, but also with the authority and confidence to do the right thing, to offer compassion and empathy as much as strong professional skills. In highly complex health and care systems, the most valuable resource we have is the staff who offer face-to-face care. And dementia is about person-to-person care. That is what people come into health and care systems to deliver and what people with dementia and their families expect. Third, we need to keep people with dementia and the people who care for them fully involved at every level of what we do. They keep us honest about success and challenge and tell us where we need to improve. And I have to say, in Scotland, we welcome that challenge. It's not once, in fact, it's probably most times, but when we've met with the Scottish Dementia Working Group or NDCAN, we've met with them with either Nicola Sturgeon or the First Minister Alex Salmond or Alex Neil or Shona Robeson. On each of those occasions, generally they tell us one or two things which aren't really working the way in which we describe them in our wonderful policy documents. And that's quite helpful, in that we don't always believe that everything does work, but it gives us a basis in which we can go back out into the system and challenge and improve. So we need to keep that challenge part of the process. We believe that people who are living with dementia and the people who care with them will hold us to our commitments on compassion, dignity, understanding the person, supporting capability, self-direction, engaging and valuing, and we look to that. And we need to be real about the challenge, but not accept second best. Too often we see long-term conditions like dementia pushed aside when new acute problems come along. I think just even in the past few days, we've seen in a number of the discussions that we've been having that people in other organisations are being pulled into discussions about Ebola. We've previously seen similar phenomena with pandemic flu, in that it's a lot easier to become involved in a crisis which is immediate than a crisis like dementia. So we need to continue to say that we will not tolerate second best for dementia, and that we expect the same airtime, and we expect the same research commitment and the same funding commitments as other groups do. We have to continue to take this work forward on the basis of human rights, dignity, and compassion. So dementia has come a long way in the past few years and is now in the global agenda. In Scotland, we're proud of how far we've come with the support of many people in this room, but we recognise we still have a long way to go. We feel we're slightly ahead of the curve, but the curve is a wee bit behind where it needs to be, probably a good bit behind where it needs to be. So I've got an ask of you. Shortly, Henry's going to make me sign the Alzheimer Europe Glasgow Declaration, and I was a bit uncomfortable with that because I hadn't seen it when I was being signed up to do that, and I was advised that wasn't necessarily a good thing. So I've now read it, and I've told Henry I agree with at least 75% of it. So on that basis, I can sign. And I'm proud to do that. Tomorrow, Alex Neil will also sign it on behalf of the Scottish Government, and he'll be the first government minister to sign the declaration. And again, we're proud of that. But I'd like to see what you would ask of us, what you'd ask of us in the Scottish Government for the next period of time. I'd like to see what you would ask the World Dementia Council in the next period of time, because I think it's important that in the same way that we seek out your views and want to hear your perspectives, that they should hear your views. So I'm going to help you out a bit here again. So I'm going to give you the Scottish Gov Health is Us. So anything you attach to that, I'll see and we'll see, and Alex Neil will see. Anything you put to World Dementia, I'm hoping the World Dementia Council will see, but I'd like to see you put your aspirations on there. I have to say tonight you've been a very well-behaved audience so far, so I'm asking you to maybe set that aside and be a bit more pushy, say what your expectations are, but also attach it to the hashtag for the event so that they know where the noise is coming from, because you have a contribution to make, and we'd like to facilitate that if we can. I'm encouraging you tonight to make a noise and be heard, and to do that for the next few days. We will continue to listen, we'll continue to learn. I hope you have a really good event for the next 2 or 3 days. I think I'm talking to you again tomorrow, and again on the following day. But it's been a real privilege to be able to speak to you this evening, so thank you.